Welcome to this masterclass on transmission-based precautions, covering airborne, droplet, and contact precautions. This video is brought to you by Mr. Nagesh Sir and ND Nursing Coaching. Let's start with a multiple-choice question on TB transmission. Which precaution is mandatory for a patient with pulmonary tuberculosis? A. Droplet precaution, B. Airborne precaution, C. Contact precaution, or D. Standard precaution only? The correct answer is B. Airborne precaution. Tuberculosis is transmitted through airborne droplet nuclei smaller than 5 microns, which remain suspended in the air. Therefore, an N95 respirator and a negative pressure room are required. Next question. Which of the following diseases requires droplet precautions? A. Influenza, B. Measles, C. Varicella, or D. Scabies? The correct answer is A. Influenza. Influenza is transmitted by droplets larger than 5 microns generated by coughing or sneezing. Surgical masks are required for staff and visitors. Moving on to MRSA precautions. What precautions are needed for MRSA colonization? A. Airborne, B. Droplet, C. Contact, or D. Protective? The correct answer is C. Contact. MRSA, or methicillin-resistant Staphylococcus aureus, is primarily spread by direct contact with the colonized patient or contaminated environmental surfaces. Let's discuss PPE doffing. What is the first step in doffing, or removing, personal protective equipment, PPE? A. Remove gloves, B. Remove gown, C. Remove mask, or D. Hand hygiene? The correct answer is A. Remove gloves. Gloves are usually the most contaminated item, and removing them first prevents further spread of contaminants to other parts of the PPE or the body. Next up is a question on measles. Measles requires which transmission-based precaution? A. Contact, B. Airborne, C. Droplet, or D. Universal? The correct answer is B. Airborne. The measles virus is highly contagious and spreads through the air over long distances. Therefore, strict airborne precautions are mandatory. This question is about varicella, also known as chickenpox. Varicella requires which precautions? A. Airborne, B. Contact, C. Both A and B, or D. Droplet? The correct answer is C. Both A and B. Chickenpox is highly contagious and spreads via airborne transmission, and also by direct contact with the vesicular fluid of the skin lesions. Next, let's look at meningococcal meningitis. What precautions are needed for meningococcal meningitis? A. Airborne, B. Contact, C. Droplet, or D. Protective? The correct answer is C. Droplet. Neisseria meningitidis is spread via large droplets. Isolation is required until 24 hours of effective antibiotic therapy is completed. Now for an MCQ on C. difficile. For Clostridium difficile diarrhea, hand washing with what is required? A. Alcohol-based rub, B. Soap and water, C. Chlorhexidine, or D. Povidone iodine? The correct answer is B. Soap and water. Alcohol does not kill C. difficile spores. Soap and water are essential to mechanically remove spores from the hands. Here's a question on airborne PPE. Which mask provides protection against airborne pathogens? A. Surgical mask, B. N95 respirator, C. Cloth mask, or D. Face shield? The correct answer is B. N95 respirator. N95 respirators are designed to filter out at least 95% of airborne particles, including the fine nuclei in tuberculosis. This MCQ is about droplet PPE. Which PPE is sufficient for droplet precautions? A. N95 mask, B. Surgical mask, C. PAPR, or D. Nothing required? The correct answer is B. Surgical mask. Droplet precautions are for larger respiratory droplets, and a surgical mask prevents inhalation of these droplets from the patient. Next, let's look at negative pressure rooms. What is a key requirement for airborne isolation rooms? A. Positive pressure, B. Negative pressure, C. Neutral pressure, or D. HEPA filter? The correct answer is B. Negative pressure. This ensures that air flows into the room rather than out, preventing the spread of airborne infectious agents to other areas. Moving to pertussis. Pertussis, or whooping cough, requires which precautions? A. Airborne, B. Contact, C. Droplet, or D. Standard? The correct answer is C. Droplet. Pertussis is spread through respiratory droplets. Isolation is required until 5 days of effective antibiotic treatment are completed. VRE is next. VRE, or vancomycin-resistant enterococcus, requires which precaution? A. Airborne, B. Droplet, C. Contact, or D. Standard? The correct answer is C. Contact. VRE is spread through contact with contaminated surfaces or objects, necessitating the use of gloves and gowns upon entering the patient's room. Consider the COVID-19/SARS scenario. For aerosol-generating procedures in COVID-19, which PPE is required? A. Surgical mask, B. N95 respirator, C. Face shield, or D. Gown and gloves only. The correct answer is B. N95 respirator. Aerosol-generating procedures create fine aerosol particles, which require airborne precautions, including an N95 or higher-level respirator. Our final question is about hand hygiene. The cornerstone of all transmission-based precautions is what? A. Mask usage, B. Gown usage, C. Hand hygiene, or D. Patient isolation. The correct answer is C. Hand hygiene. Proper and timely hand hygiene is the single most important measure to prevent the spread of infections. Let's review rubella. Rubella, or German measles, requires which precaution? A. Airborne, B. Droplet, C. Contact, or D. Standard. The correct answer is B. Droplet. Rubella is spread via large respiratory droplets. Therefore, droplet precautions, including a surgical mask, are required. Next, let's consider respiratory syncytial virus, or RSV, in infants. RSV requires which precautions? A. Airborne, B. Droplet, C. Contact, or D. Both B and C. The correct answer is D. Both B and C. RSV is primarily spread by large droplets and direct contact with secretions, necessitating both droplet and contact precautions. This question is about maintaining a sterile field. Which action helps maintain a sterile field? A. Donning sterile gloves first, B. Touching the outer edge of the sterile drape, C. Keeping sterile items above the waist, or D. Allowing unsterile items to touch sterile items. The correct answer is C. Keeping sterile items above the waist. This is a fundamental principle of maintaining sterility, as anything below the waist is considered contaminated. Let's review the PPE removal sequence again. The correct order to remove PPE is A. Gloves, gown, mask, eyewear, B. Eyewear, mask, gown, gloves, C. Gown, gloves, eyewear, mask, or D. Mask, eyewear, gloves, gown. The correct answer is A. Gloves, gown, mask, eyewear. This sequence minimizes the risk of self-contamination, removing the most contaminated items first, then proceeding to less contaminated ones. Next, let's discuss disseminated herpes zoster. Disseminated herpes zoster requires which precautions? A. Droplet, B. Airborne, C. Contact, or D. Both B and C. The correct answer is D. Both B and C. Disseminated herpes zoster, or shingles, involves both airborne spread of the virus and contact transmission from lesions requiring combined precautions. Our next MCQ is about mumps. Mumps is transmitted via which route? A. Airborne, B. Contact, C. Droplet, or D. Vector-borne. The correct answer is C. Droplet. Mumps is spread by respiratory droplets from an infected person's coughs or sneezes. Isolation is vital until 5 days after parotitis onset. Finally, let's discuss scabies. Scabies requires which precaution? A. Airborne, B. Droplet, C. Contact, or D. Protective isolation. The correct answer is C. Contact. Scabies is a skin infestation spread through direct, prolonged skin-to-skin contact, making contact precautions necessary.